Well, the doctors working on the front lines here in Oregon say that they are seeing younger and sicker patients coming into the ICU in this latest deadly wave of COVID-19.
And some of these stories coming from the emergency room are disturbing. Jennifer Dowling talked to a doctor about what's been happening in hospitals across the state, and she shares those stories with us. Jennifer?
Well, Jeff and Liz, some of those patients are dying. Some are experiencing near-death experiences, and some have lingering symptoms long after they catch the COVID-19 virus. The doctors we talked to say no matter what your age, you need to be cautious because it's not worth gambling with your life right now.
Some of the scariest stories are the individuals that are young, that are in their 30s to 40s, that walk in to the hospital and die within an hour or two.
Dr. David Hotchkin of the Oregon Clinic says he's seeing an alarming number of healthy and active people in the ER.
We had a younger individual who died in the emergency room after showing up and doing okay. Luckily was able to be resuscitated, so we were able to bring his or her heart back, and they're recovering.
He's seen COVID strike a physically tough man so hard he could barely eat.
Someone who did heavy physical activity for his job, who got so sick that he could only take one bite of food every 5 minutes because it took him so long to recover his breathing that he could take another bite. I mean, this is a guy that, like, for his job, lifts heavy objects and carries heavy beams. He was so tired, he could barely lift a fork loaded with scrambled eggs.
And a physical therapist told him it took her a month to feel like she was walking normally again after battling COVID.
That's a physical therapist who is active, knows how to take care of herself.
The doctor says of those who are experiencing moderate to severe disease, 50 to 60% still report lingering effects for 2 to 3 months afterwards. He says everyone should be taking precautions.
If we make sure that we are not potentially spreading COVID, that we're wearing a mask when we're outside, wearing a mask anytime we're inside any other facility other than our own home, and not having social interactions with other individuals, we can help stop the spread of COVID and help save the lives of other individuals.
And the doctor is also reminding everyone to get their flu shot. He says that's important so you don't get two viruses at the same time or spread the flu around, which can have consequences as well. He says comparing the two viruses, of course, COVID is much worse. He says that studies show that the risk of death doubles with COVID as opposed to the flu. Back to you in the studio.